But on the solar energy part, we don't have a capacity at that particular point in.
Okay. Professor Samson Mampweli, always good to speak to you. So thank you very much for your time. Well, South Africa is bracing for a fifth wave of COVID-19 infections. This is the number of cases in the country has seen a marked increase in recent weeks. At some point, we've been recording about 10,000 cases or so each day. Let's speak about the situation with Higher Health Chief Executive Officer, Professor Ramneek Ahluwalia. Prof, a very good evening. Welcome to the program as always. So you are now encouraging especially the student community in the country to get vaccinated in light of this peak in infections. But I wonder if you think people will be motivated enough as a result of the surge to get vaccinated, given that we're now being told that the focus should be on the number of critical hospital admissions and deaths?
Tembi, thank you for having me and good evening to everyone. Tembi, you're absolutely right. Tembi, we find ourselves in a very interesting time and challenging time. One of the major reasons where we see these major blips, I won't say fifth wave, because I don't think entire South Africa has yet entered into the fifth wave, but we are looming down on, and in certain provinces, yes, we probably are in the borderline phases where we can classify themselves into the fifth wave, and these are worrying signs for us. So what's happened is we've got what we call it a festive season, which obviously led to behavior change, a lot of socialization, which exactly what the virus enjoys, while we have a dominant Omicron variant that was in South Africa when the socializations happen. So behavior change was very important. The second thing is we do see an early winter coming. South Africa has seen a winter change, a climate change, and this has been building people indoors, a lot of congregations and socialization happening indoors with less ventilation, exactly what the virus wants, and in an airborne disease, that becomes absolutely a very critical factor. And thirdly, and the most important part, what happened at the same time, is the same Omicron variant that existed, which is dominant, further mutated, which is normal viral evolution. And what has happened is, for the first time, South Africa, or the entire global world is seeing a wave being spiked by a subvariant of a dominant virus that remained into the system, which means it's not a new variant that's displacing an Omicron variant, but its own offspring, which is BA.4/5, which has shown immune evasion and more contagiousness, which means it gets unrecognized when it enters our human body. So this means it's all these factors came so together that this has alerted us that we can gradually, if we do not get few things right in order, we might end up into a blown fifth wave, which might not be too good for us as a country at this stage, while the winters are just starting, because in the winters, we do anticipate probably another variant that possibly looms around us. It will displace the entire Omicron and cause us those spikes of COVID once again. So just to be careful and vigilant.
Just on the issue then of vaccination, which is what you're now encouraging at this point, we have seen in the last year, since vaccines were made available in South Africa, that during the peak periods, as far as infections were concerned, there had been an increase in the number of people who actually lined up to get vaccinated against COVID-19 or for COVID. But that's not exactly an effective vaccination strategy, isn't it? To rely on moments of a serious surge in infection to drive people to the centres.
Absolutely, absolutely, Tembi. What people need to know is that even though 80% of South Africans have got acquired immunity, whether it means they got infection in the first, second, third, or the fourth wave, our immune system weans down with time. This is a natural phenomenon. This is a normal human scientific phenomena, which means any immune system weans down with time, which means you need to boost your immune system. There are only two ways to boost an immune system. Take a vaccine at the right time when the booster is required, or if you're not taking vaccine, this is a good time to start your vaccination program, because your immune system, when it weans down, needs a further jack up, which the vaccine does provide you. And you need that in your winters, when you know it's an airborne disease, you will be in close congregations which are indoors. And of course, with masks, these will be probably the most important factors that will safeguard us. So vaccination is very critical, because a weaning immune system gets jacked up to build its back to its levels, that when a wave is high, when the virus is more contagious, what you need is, the virus doesn't know whether you have vaccine or not, or you have an acquired immunity. The virus will enter. it needs your immune system to be strong in order to overcome that virus so that you are not going into that severity and exactly how you started by the word ICUs and hospitalization and deaths. Because breakthrough infections will happen, but eventually your immune system should be in a position to overpower this virus.
Right.
And that's only should you have your boosters and vaccines.
To what extent would you say the government is still in control of the country's battle against COVID, or at least at this stage, the attempts to manage its spread?
I think South Africa, comparative to other parts of the world, what we're seeing in China at this moment, or in North Korea, or many other parts of the world that we're getting the information with, South Africa has fairly done well. Why I say so is because, first, at this moment, removing a national state of disaster is very sensible, because this is a developing country where lots of South Africans depend on informal settlement or everyday wage, which needs food, and that's more important at this moment. While we know 80% of South Africans have acquired immunity, which will protect them against severity of the disease, which has been acquired by getting COVID during the first, second, third, or fourth wave. Now, with 30% and above population, in fact, 35% and above population being vaccinated above the age of 30, and over about 62% population, 65% population vaccinated above the age of 60, gives us that other boosting confidence to say we have a vaccine immune system, plus what we have is acquired immune system. This should help towards fighting the severity of the infection, not guaranteed, but help far away in severity of the infection. That's what is giving South Africa that a slight advantageous or stronger position. But what we need to be careful is educating them now again and again. Yeah.
Well, you're now almost out of time, but I wanted to squeeze in one last question about the flu season. Many people are saying they're down with a terrible flu at the moment. There's also concern about that, because some are saying what may be happening is, yes, others may have flu, but we may be missing a lot of symptomatic cases in South Africa at the moment because people assume it's the flu. Is that greatly concerning, or does it not matter at all given where we are?
It is concerning. What you do not want in this winter is your human body fighting two viruses at the same time. We are aware this COVID is extremely contagious. It's a similar airborne disease. So, I mean, indoors means closed congregations, winters. You need to have ventilations. You need to make sure you're not in the crowded spaces. You have to wear masks. The same methodology applies to the flu, because flu is also an airborne disease. And both viruses are circulating in the winter season in a very faster phase. Both are extremely contagious. So you do not want to have two viruses at the same time when your body needs to fight these, and you have the same immune system fighting them. So my request, get your vaccine both for the COVID as well as for the flu. You can get at the same time. Both help in boosting your immune system separately for two different virus levels, and recognizing these viruses and helping your body to fight them. And in the same winter, and other three parameters: wear a mask, ventilate, make your windows and doors. Even if you have to wear extra jerseys in a cold season, you have to do that. And thirdly, please get your boosters.
Thank you very much for your time.